strangest feeling to know what to believe in.
Hi, my name is Vinita Chandramodi, and I'm the founder of Stroma Physical Therapy and Ischemic Conditioning Techniques, or ICT. I started this practice to have creative flexibility to give my patients the best possible care without constraints. No cookie cutter therapy, personalized, targeted, and effective therapy to get people stronger and better. We don't just teach you what to do, we teach you how to understand your body as you are the captain of your own ship. It's not just about performing an exercise or lifting a leg, but activating the right sequence of muscle patterns to create the optimal effect. At Stroma, we look at how pain and dysfunction influence the whole body, not just the area that hurts. After all, we are a fine-tuned machine. As a manual therapist, I realized that we could influence and treat much more than just a single muscle tissue. So I developed a full body technique that uses mild blood flow restriction to help influence tissue repair. All of our therapists here are trained in the technique. The missing ingredient in most PT is love. We love and are passionate about what we do here at Stroma so that you can become your best self. Come to Stroma so you can move, perform, play, walk, stand, live, heal, and finally feel better.
At the hip joint, which can increase the risk of FAIs as well as labral tears. I hope did that make sense? A lot of mechanics. Okay. If someone has foot pain and excess motion in the transverse plane, how do you determine if this is due to pelvic floor weakness, and how could you treat this? This is like an awesome question because it's not easy to see this. It's not necessarily what you're looking at. But if somebody comes in with excessive transverse plane motions, they're pronating, this is where the PVAS might be really helpful. So you don't want to necessarily address that there's pelvic issues. You might start to ask questions like, oh, you have a lot of laxity. Do you have laxity other places? Are you, do you have any low back pain? Do you have anything related to your urinary or bowel issues? So then you start asking more questions, and answers that come through start helping you direct the questioning towards that pelvic floor. So I love the PVAS for this reason. Now, if you could just give them the PVAS and they could answer the question, already you're determining whether they themselves can even activate or not, or release. And if you find that, then as a non-pelvic practitioner, you'll be able to say, okay, maybe we need to activate. Maybe you need to pull up a little bit and squeeze between your pubic bone and your anus. And there's some instructions on the PVAS that I give you on how to instruct your patient. And so if that helps boost them, or you see a correlation or an improvement in their MLA, for instance, with a pelvic activation, put them on a BOSU and see if that improves their ability to stabilize. That can all contribute to whether or not there's a mechanical relationship there. So you treat what you see. You treat the excessive transverse plane motion, but if you can boost them in the other environment, why wouldn't you just do that in the moment? Because it might help them in the end. Okay, I'm at the end of questions. Anybody want to talk about it verbally, or you can continue to use the chat?
Yes, feel free to unmute your mic and speak any questions that you have, as well as put things in the chat.
So I can
Hi,
talk
Vanita.
to.
This is.
Oh yeah, go ahead. Go ahead.
Sorry, this is Chloe.
Hi, Chloe.
Interestingly enough, hey, I ran into a lady at a conference, and she was telling me how a pelvic floor PT had helped her during her time of pregnancy. So I was just wondering if you ever treated and or dealt with pregnant females, and like exactly how you treat them, and like what do you do? Because she said she was having a lot of pain. She thought it was just part of the pregnancy. but it actually it wasn't. So then she went, and I don't know if she didn't really go into details, but
Mhm.
I don't know what they corrected per se, but I just wanted to know more about that because I thought that was pretty interesting. So I would never think to
So,
go to a pelvic floor PT during
yeah,
pregnancy.
I have a lot of women who are pregnant that will seek out pelvic floor PT in anticipation for issues that might turn up in the fourth trimester, which is the first 3 months of a child's life, because women are, it still feels, they call it the fourth trimester because it feels like you're still pregnant, even though you're not, but you're dealing with some of the effects of pregnancy. It's a really good question. So what I say is, if you have a referral for pelvic floor PT from a physician that suggests pelvic PT, to me, every practitioner is going to find their comfort zone with this. For me, I don't introduce digital exams into a pregnant woman's vaginal environment for risk. But and I don't do internal work for women that are pregnant, but there are so many other things that can be done. Not to say that you can't do it, you can. I just make that personal choice. I do other things because I think there are many other things that you can do to improve pelvic tension without having to go internally. So I'm not sure what this patient may have faced, but as a practitioner of this area and of pregnancy, I would do a lot of things that, I draw on my other ortho skills. So I'd be doing a lot of lumbosacral stabilization, deep breathing, stretching, teaching positioning. I do external fascial work on the labia, the hood, the vestibule. So there's a lot of other techniques that can be done without having to insert. But is it possible? Yes. It's not my choice or not my decision that I do that.
Cool. Thank you so much.
Such a good question, Amelia, I did not talk about sexual trauma at all. I talked a lot about psych. So in my coursework, and my coursework has changed. So I've been in coursework for pelvic PT for 12 years, probably 12 years. And at the beginning of my coursework, there was a lot of skills to have the so often, to answer your question directly, during internal exams, I'm always describing what I'm doing before I'm going to do it. So it prepares the patient. I'm using words, I'm using soft words. I'm being very, very deliberate on every single thing that my best tool in the pelvic floor room, my finger, does prior to doing it. I do that with everybody. So it is not just with a sexually traumatized individual. But at the beginning of my coursework, we were kind of taught to approach a digital exam as a part of therapy for people that have suffered from trauma. And more recently, there has been a focus on something called sensate focused therapy, which is really a non-internal touch-based approach to dealing with trauma. So you start with like inanimate objects and touching a patient in a variety of positions. And so you don't have to do an internal exam as a part of your initial evaluation. There's nowhere that says that in the coursework that this must be done. It doesn't have to be done. It doesn't have to be undone on the first session. It doesn't have to be done on the third session. At some point, the whole point for them to be there is to get over the trauma or to have better sexual, urinary, or digestive function. So you have a purpose, but it doesn't have to happen on the first session. And it's really based, you have to put the power into your patient's hands in a situation like this. And so it is delicate. It takes a lot of time to learn how to do that. With good coaching, you can get there. But yeah, you don't have to do it on the first session. And there's other approaches, other non-internal approaches to helping PTs. To helping patients. What I learned about from COVID, actually, I hate to say the COVID word, but what I learned about COVID is when your hands are tied and you have to do telehealth sessions with patients, what I was so blown away by, because I'm such a strong manual therapist, is when my hands were tied, I was still really effective. I was shocked by that because I didn't think I could be as strong as I was as a therapist without my hands. And so even with a pelvic patient that you're doing a telehealth session with, there is still value added based on all of the information and all of the different tools that you have to be able to get somebody better. But if you're looking to learn more about sensate focused practice, I can get some information on that. It's a UK based approach. So I'm going to close off, if there's no other questions, with one case example. I had a patient who had shoulder pain from a surgery, and she had gone to a really great therapist that I know in the city post-operatively. Amazing therapist. I know this person well, and she did fairly well, but she was still in quite a bit of pain. And she came to see me because the therapist had referred her to me and said, well, maybe Vanita can figure it out. And so the patient came to me, and as I talked to her, this is for post-op rotator cuff repair. I started talking to her about her shoulder, and I was like, you've been there for like, I don't know, 60 sessions, some crazy number of sessions. I was like, okay, you should really be better by now. And so I talked to her, I said, well, is there anything else you want to bring up? Do you have any history of back pain or problems? And she talked a little bit about, she's like, well, I feel like I can talk to you. If she felt open enough to talk to me. She had some sexual trauma, but more importantly, apart from the sexual trauma, she had a very large episiotomy from birthing her daughter 44 years ago. And so I said, okay, all right, well, let's try working on your shoulder. Let's see if I can work some other magic and get you better. And, I said, but this is the other side of me, is I'm a pelvic floor PT, and you've brought up some things that were interesting to me to think about how this might influence you and your shoulder. I explained what the pelvic sling was and its sump pump function, and she kind of bought in. And so in a few sessions, I said, we don't need to do this now. We can talk about it later. Whenever you're ready, you can bring it up to me. And on the third session, she said, Vanita, I want to give this a try. I think this would be important, especially because I'm having some issues. Like I can't have sex with my husband, and there are some issues. So I ended up working on her for 2 sessions. So I saw her for a total of 5 sessions. And the improvement that we made, so what I found in her pelvic sling is that it was hypertonic, weirdly. It was really, really much more restrictive than I was expecting. And she had more pain than she really ever even let on. She didn't know that she was in pain because her shoulder, I guess, may have overtaken it. But what was so interesting is when we restored her pelvic floor function, it improved her intra-abdominal pressurizing of her spine, and she was able to stand straighter, which corrected her anterior tipped scapula and reduce the pressure subacromially. And so in 5 sessions, I treated somebody's shoulder through their vagina. The end. Any other questions?
We got a question about the contact information for my read. I'm sorry if I said that incorrectly. Should they reach out to my read at Stroma PT, or
yeah, let me
I didn't know. For some reason, I'm so sorry. I did notice that it's Mairead1 at stromapt.com.
Oh, I'm sorry.
I think I just popped in. It says Mairead. Mairead1 at Stroma PT. I'm really happy to answer any questions if anyone wants to jump on board. Again, our patients love it's a subjective questionnaire. It makes them feel comfortable. We get a lot of feedback with it, and it's just a really, it's a good opportunity for anyone who wants to, jump on board, is into research, help us with the grant application. If they do, exciting work at the APTA Pelvic Floor Academy. So they have past research topics have been really interesting. I don't know. I certainly would love to see the PFAS scale there. It would certainly a great way to make, patients feel comfortable, So anyone, feel free to reach out.
Thank you so much for presenting this today, Vanita. This was so informative. I'm so happy that you were able and willing to give your time and experience with us. Of course, anyone reach out to Vanita if you have more questions. I'm sure you would be happy to answer them. And thanks for everyone coming out tonight. Yeah.
Yeah, thank you. Thank you. I was happy to do it, and please support the SIG. It's been such an interesting part for me to learn more about these opportunities for students. It just enhances you as a practitioner later on. So thank you, Sabrina.
Yes, and if you saw in the chat, there's a link for a feedback survey, so check that out. We'd love to get your feedback. Thanks, everybody.
Thank you for hosting. Thank you.
Thank you so much.